my pleasure to introduce our first of the grantees who will be speaking. This is Betsy from Children's Hospital of Wisconsin, the rheumatology clinic, and she has been focusing in the Fox Valley location. Betsy, I am going to advance the slides for you as well as for the other grantees, if you don't mind.
So the first one is our aim statement. And our aim statement was that we would, first of all, everybody up at our camp, we run a camp in the summer for our patients who have all the rheumatic diagnoses. So we're up at the Wisconsin Dells using the Easter Seals camp, and we have 87 kids here today. We came on Saturday, and we're leaving tomorrow. So our first aim statement for transition for the rheumatology population in Fox Valley was to work with Children's Hospital of Wisconsin, IT department, and generate a list of all of the patients 15 years of age and older who come to the Fox Valley site so that we could initiate the program of transition with them. Our next aim statement was that we would introduce at least 10 by the end of the year, 10 patients onto the rheumatology transition program. And as of this date, I believe we looked at the policy that we have already generated from our main campus in Milwaukee, and we adapted it and added to it for the Fox Valley. So those were our aim statements. I believe the next slide is our team. Currently, our team is myself as the nurse practitioner, Marie Armstrong, who is the nurse up there for rheumatology in Fox Valley, and Tracy Ratzberg, who is the Northeastern Regional representative from the state, as well as Joy Aherns, a mother, and her son Tyler, and another mother, Mrs. Lyons, and her son Courtney, her daughter Courtney, excuse me, and then Dr. Nocton is the other provider that goes to Fox Valley along with myself. Right now, I go to Fox Valley the second Thursday of the month, and Dr. Nocton goes to Fox Valley the fourth Friday of the month. We did have 3 providers that were going there, and our third provider unfortunately left our site. There may be more clinics offered in the future, but at the moment there are 2 clinics offered every month. In addition, some of those patients come down to the Milwaukee campus if they need to be seen in the interim. And
Betsy, I have your process and implementation slide up, so we're talking about the process.
Okay, so our process is that we approach all the patients who are 15 years of age and older with a chronic rheumatic condition, of which there are a number of them that we are currently addressing: juvenile idiopathic arthritis, systemic lupus erythematosus, dermatomyositis, spondyloarthropathy, chronic uveitis, and it goes on and on and on. So what we are doing is giving the teen and the parent, we have an introductory letter to invite them into the transition program and explain a little bit why we feel that it's important to start early in educating the teen about how they can learn about and be their disease process and their medications and side effects, and learn in the future how they can call in for refills, make their own appointments, spend individual time with the provider. Then we are giving them a individualized rheumatology binder, which has information about their disease process, their current medications, their past medications, and the side effects of those medications, so they can learn about it, as well as just general information for transitioning to adult health care. And then third and fourthly, we are putting transition as an active problem on their problem list and their medical record. So if they go to different specialties, or their primary care person can see that we are working on transition. And we are also piloting a free medical app called Health Spec, HEALTHSPEK. It's a free app that they can put on their phones, because we found that the binders were very helpful. However, once they got the binder, For the most part, it didn't come back and forth with him. So all the teenagers always are with their phones. They live on their phones. And frequently when I see them, I have to ask them to come off of their phones. So now I engage them in their phones and say, okay, here's your phone. Let's utilize it in this appointment. Let's download this free medical app and show you how you can put all of your information regarding your chronic illness, your side effects, your medications, your allergies on this app, and your phone is always with you.
Great.
So,
do you want me to go to the next slide, Betsy? Okay.
Yes, please.
You have resources and supports, and you list the interactions you've had with Tracy and Nancy, and then the new social worker.
Okay, so Tracy is part of our team, and she has been very helpful to engage us in, she got us the resource of Nancy, who is a physician liaison in Milwaukee and for the whole state. Children's Hospital were their sites to help us identify in the area adult rheumatology providers so that when the patients are ready actually to transition, we can check with their insurance and see who they can go to. See, in pediatric rheumatology, you have to go to a center. So there's only 3 centers in the state. It's Milwaukee, Madison, and Dr. Keim is a pediatric rheumatologist in Green Bay. So your insurance has to allow you to go to one or the 3. When you go on to adults, there's probably 50 to 75 plus adult rheumatologists in the state. And then you can actually look at your insurance, and your insurance may mandate who you go to. So we try to work with the families and see who is on their insurance panel, and then give them information and help them transition to that appointment. Up here at camp with me this summer, yesterday, actually, let me think. Okay, for Monday going into Tuesday, Dr. Paul Tuttle, who is a new rheumatologist who covers both peds and adults in the Green Bay area, came to camp with us for the first time, and he was here for 24 hours. He also helped me do the transition talk with 32 of our older teens from all over the state, northern Wisconsin and Minnesota, on Monday night. We had a nice discussion for a little over 45 minutes down at their campfire, talking about transition, how we can prepare them, and from his standpoint as an adult rheumatologist, what's helpful for him to know as he accepts these patients. So it was a nice blending of information. And there is a new social worker at Fox Valley who just recently started, who will be available and covering the rheumatology population as well as other populations. So she is a new member of our team.
You had next steps. So you talk about a poster, the camp, which you've kind of talked about a bit, the letter to parents and teens, and then broadening the population. Okay, so I sent a letter to about 15 of the families of the new 15 in age group of teens in the Fox Valley area, hoping to plan a program for them in the fall up in Fox Valley about transition. I've only heard back from one of them. So Marie, Tracy, and I have proposed that we expand it, and Tracy, Marie, and I are going to plan a program for on transition for teens in the fall in the Fox Valley area, and we're going to invite teens who also have probably GI, inflammatory bowel disease, and diabetes, so that there will be broad topics related to transition that can go across many of the different subspecialties. So I think as long as we're going to plan this, I have felt that it would be appropriate to open it up to the additional population. And Tracy and Marie are helping to plan that and will be involved in that process. Great, and we'll look forward to hearing how that goes. Thank you, Betsy, very much. Thank you. Gunderson Health System.
Hi, Maya. This is Janet. I'll be presenting this. The first one is just kind of an overview of what Gunderson is, what the county that we serve, approximately how many pediatric patients we have that have Gunderson listed as their PCP. We currently have absolutely no formal transition program, policy, guideline system in place, and the age of transition is determined by individual providers. So we are starting pretty much from ground zero with this whole process. The pediatric neurosciences department has done some work in this area because they, as a general rule, need to have their patients transition to an adult provider no later than age 21. So this is who makes up our team. Our champion lead is a general pediatrician, Dr. Randall, and then project coordinators are myself and Chris Edwards. We co-share that role. And Catherine is our senior office assistant who schedule meetings. And then Linda Miller, she's the pediatric clinical manager. She joins in as often as she can. And our aim statement is short and sweet. So that are two goals that we think we can have achieved. At the end of the year, it's to have our policy developed. Right now, our policy is in the review phase. And the second one is to host our events. So what's our work been? It's been lots of meetings and lots of brainstorming. We have presented to a parent advisory committee the whole idea of our goal to get a formal transition program in place at Gunderson. The pediatricians and the nurse practitioners have all been advised of this work and are very supportive, along with our pediatric specialty providers, which includes endo, GI, cardiogenetics, and behavioral health. And then Dr. Randall has been busy. Actually, he's been to all the physicians, he's been the liaison, the presenter, to make those connections. And then the last two, or the next one, to present it to internal medicine and family medicine, because they will be the recipients of all these patients. And then he also has presented to what's called the Primary Care Collaborative Group, which is a group of administrators, physicians, and clinical managers from pediatrics, internal medicine, and family medicine. And then we've worked on developing our policy. So our event is scheduled for September 9th. We're going to have it in the morning. And our target audience, because we have such a large population of pediatric patients, is going to be geared towards the medically complex. And the way that we inform them of them, I got the list from pediatric care coordinators and from the providers of patients that they thought would be interested and engaged in an event. So I personally called these families to inform them of the event and explain what it was about, and then the letter was followed, or the phone call was followed up by a letter, and the letter had location, parking, what the agenda is for the morning, and the details of the event. So for our event, we have Dr. Randall lined up to speak, to introduce the transition process at Gunderson. And we're also going to have Dr. Almond Dixon speak. She's our child psychologist, and her role is going to be to speak just to prepare the family and the child transition event and kind of the behavioral health component that goes with that. And then Dawn Stark is going to come in and speak for us too about guardianship and alternatives to guardianship, because that seems to be a very, probably the most concerning topic of the families of these medically complex children, is to have that established, and once they turn 18 with what they need to have done. We're going to provide, we'll have breakfast for the families, and as a thank you, gas cards for them attending, because some of them drive from quite a distance. We're also going to have the Turbo nursing students there to help us out that day, because if families need to bring along smaller children, they'll be able to keep those smaller children occupied, so that the parents and the child that's going to transition can pay attention to our event. And some of the medically complex children may need some cares or may need to leave the room, and the nursing students will be able to assist with that so that's as needed. And then we're at the end of the event, we're going to do we haven't developed this yet, but a pre and post survey, and that will give us our QI measures for the event. So our resources have been, of course, Maya. We got Transitions Site and Dawn at the Regional Center. So our hurdles, probably one of the biggest hurdles at Gunderson with providing a good transition plan, it's been access to adult providers, getting an appointment in a timely fashion. And the key is finding the right adult provider, especially for the medically complex child. We want to, the pediatrician has been someone that has cared for this child since they, likely from birth, knows the child in and out, and we want to find the right fit in the adult provider to care for the child. And then getting meetings set up with the key stakeholders, and that would involve, the appropriate people in internal medicine, family medicine, to help with our access situation. Epic is our computer system that we use here. We've got lots of ideas for Epic build. So we need to, that's a process in itself, is to get Epic upgrades to include the different things we're hoping to develop in Epic. And then, because this is a large institution, just moving forward with plans and ideas. So next steps that we plan on doing soon is developing a patient family transition handout, doing staff education, and that staff education would include providers, pediatricians, and the MAs and nurses in the pediatric department, piloting a readiness assessment, explore the option of the Epic Transition Registry. We would like to see a registry built, and then pilot transitions to adult provider.
So transplant clinic, again, Shelley, I've been advancing the slides. I'm having issues with the control button. So please just let me know when you'd like me to move forward.
Okay, so when I was doing the background on transplant patients and transitioning, it is a time where, obviously, as we all know, it's a critical time in the patient's healthcare, and also for transplant patients specifically, it's a time where patient survival and graft survival of their organ are actually the lowest out of any other time in a patient's life. And so our goal was to try and increase these patients' self-management skills that would hopefully help them to have a better outcome once they moved on to adult care. So this slide just gives a little bit of background of some of those research studies that I had looked at. You can go ahead, Maya. So this is the team that I had put together to work with this project. Stacy Boyce, our social worker for kidney transplant. Stacy and Gail, who are liver and heart transplant coordinators here at Children's, both adult and pediatric nephrology team members, a pharmacist, our adult social worker that we transfer a lot of our patients to at Froedtert Hospital, as well as both pediatric and adult hepatologists. They were all part of the project planning for the transition class that I put together. And then Taylor, Nicole, and Katie were 3 former patients of Children's Hospital who have gone on to adult care, are at different stages of their life, but they were also involved in the project to help patients learn kind of real life scenarios for what they've dealt with over their lifespan. Go ahead. So the aim statement was to design and implement a transition class, which would hopefully include 20 transplant patients and their caregivers. The class participants would complete a transition readiness survey before the class as well as after the class. And then improvement would be measured on looking at the patient's knowledge and skills of the overall process, as well as some of the agenda items that were included in the class. These agenda items included that patients would understand the expectations of adult provider teams, the importance of self-management skills, and then also being able to carry out those skills to care for themselves. Go ahead. We used the PDSA plan to, as we went along with the classes, to try and change things up based on feedback that we got. And so after the first class, the class I should say was offered 3 times for patients. And so after each class, we took feedback from the patient surveys to try and change things if we could to, based on that feedback that we had gotten from them. And one thing that families had asked was for patients to give more of their own story, which was kind of tricky because certainly not all patients are comfortable giving their own story, but we tried to implement that. Additionally, what really came out of the surveys was that families and patients are looking to connect more and had some suggestions such as support groups or mentoring programs that hopefully we can try and implement in the future. Because the families that did participate were, we had very positive feedback, but also are obviously looking for more ways to connect their children with other patients. Go ahead. So we use the Children's Hospital Transition Teaching Sheets, which are available on our intranet system for some of the handouts that we provided patients during the class. Both Stacy and myself are part of the Children's Hospital-wide transition committee here, so that was another resource and support. At each monthly meeting, I would update the committee on how things were going with the project. Both children's and Freighter kidney teams, as well as the heart, liver, and kidney transplant teams here at Children's, were big resources because certainly that's where I was calling the patients from and needed their support on the project in order to get patients to participate in the classes. And then I'm not sure if I've said this before with our other conferences, but I just finished up my doctorate for nursing, and so my fellow DNP students were also a huge resource in moving this project forward. And then the key thing I think that I brought out of this project was that a collaboration with the adult team is really essential to having a successful transition process, and without their help, I don't think this would have been as successful as it was. So we had 3 classes that were completed. The patients did a pre-class readiness questionnaire, and then 6 weeks following the class, there was another attempt at getting that questionnaire answered again to be able to evaluate if there was any change in the patient's self-management skills following the class. And then at the end of the class, the patients also conducted or completed a class survey. We ended up with 9 patients and 11 parents, so I did meet that goal of 20 participants. And it also equals about 10% of the population that we follow in the kidney, heart, and liver programs that are age 12 years and up. So while it seems like small numbers, I think it was still a pretty good share of patients that ended up participating. The age range was from 13 to 21. We did have one outlier patient who is older but is cognitively delayed, and both he and his mom did attend the class. And then the race and gender were as follows. Yeah, next steps, in May, I did do a poster presentation for Nurses Week here at Children's Hospital. Both the adult and the pediatric teams have been given my final project paper that does show all the results from the project. The monthly updates were given to the transition committee. Now that is going to go away since the project is completed. But I'm also planning on submitting my final paper to pediatric transplantation in the near future. And then in terms of sustainability, the adult kidney team has voiced that they would like to continue working on a similar project in the future. And then also we had interest from the Wisconsin chapter of the National Kidney Foundation to work on a future project, maybe not in the same scenario that we did with this one with an in-person class, but perhaps doing something where it could be a webinar or some online education that would then be able to reach more patients throughout the state and really the country, rather than trying to focus solely on our own institution. So two very exciting things that I think and hope we'll be able to start working on as we move forward with our transition processes.
Great. Thank you very much. Karen, we're going to move on to the Ho-Chunk Community Health Center. Your line may be muted, so you'll want to take yourself off of mute.
There's about 6,000 people in our patient population. There's 2 full service clinics. One's at Black River Falls and one's in Baraboo. And then the nation is kind of spread over the whole kind of west side of Wisconsin. We also serve employees of the Ho-Chunk Nation and any Native American. Most kids have either medical assistance or contract health, and that's like a government sponsored health insurance, which provides pretty good coverage. The team is the woman who applied for the grant, our medical services director, Joan Greendeer Lee, myself. The integrated team is, I think, one of the best parts of our clinic. It's a group that meets monthly to discuss anybody having behavioral health services or issues. So there's psychotherapists, AODA counselors, pharmacists, social worker, all the physicians, PAs, and nursing staff come, and dietitians. I think that's about it. And it's really interesting. It lasts a couple hours, and everybody kind of puts in what they know about a particular patient or where they're struggling, and then put our heads together and what else can be offered. And I think I put in the wrong AIM statement. I'm sorry. We were going to get 4 out of 7 kids with ADD to come to an event like a parent support group event. So far what we've done is met in groups and individually with all the medical providers at both clinics, the integrated team members, and then the Ho-Chunk Nation Director of Education, because they are also involved in a transition project, but a little bit different than ours, but they're trying to do the same thing. And our goal is just to figure out like what is each group's concerns and what can they, how can they help with this. And we decided on ADHD because it's, I think a lot of people think of it as like a childhood disease, and it's more and more it's proving to be lifelong. And it's also, there's so much abuse potential, and especially in our population, that it's difficult to find people who will prescribe them to adults. So we need to kind of communicate with the adults, and we can do that really well with the integrated team. So our resources are Maya. Some of the websites that came with some of the papers. I went through the other clinics that went through your policies, which were really helpful. And then we also have a therapist who has had experience like working with kids transitioning in the foster care system when they transition out of foster care and they're on their own. Next slide. We have 8 patients that we're going to try to get involved with this. They're mostly male, and the insurance I kind of covered the first time. Most of them, I think the majority are Native American. I'd have to look for sure. Next slide. We created a policy and procedure for transition for both clinics with all the people above that I have talked about so far. And we've also created a pamphlet that we're going to be able to give to youth and their parents, like both at the clinic and in educational settings, like probably with the help of the educational director. Next. And then we are going to have a family event involving hopefully both departments, health and education, because ADD also extends a lot into education. And then plan a provider education later this fall. And it's also just to get everybody on board and, figure out what are the challenges that we are meeting.
All right, and that leaves us with Mala's team. I saw Mala join. Are you there, Mala?
Yes, I'm here. Great. Well, I was just going to share what we're doing here at UW Health here in Madison, and just talk a little bit about our approach. We are taking the primary care approach. I'm a primary care general pediatrician, and we're seeing what we can do in our clinics to connect with some of the other work going on at our institution. So we created a team. We have 2 primary care pediatricians, 1 pediatric hospitalist on our team. We have a clinical nurse manager, an RN who is very experienced and actually has seen many children transitioned over the years in some systematic ways and often not at all systematic. So she provides great insight to us. She's been practicing for over 30 years. The regional center coordinator for Regional Center for Children with Youth with Special Healthcare Needs for our Southern Regional Center has been very involved. We have Sophie, our youth, who is just great. She's provided a lot of input for our work that we do. And then we have 2 internal medicine physicians. And since the activities of our grant have largely consisted of activities of how we can prepare kids to be more independent in their healthcare, those internal medicine physicians have not been as active on our grant, but we definitely consult with them and we include them in all the emails and invite them to all the meetings. But I think we share some of the same challenges that other groups have in terms of engaging our internal medicine colleagues. And then we do have good support at high-level support at UW Health and leadership. So I just want to say that we're actually working within the context of a larger multidisciplinary transition steering committee within UW Health, which just really kind of formed over the past year or 2. So there's little pockets of transition work that's happening both in primary care with this grant, but also in specialty care, and that's been going on for, the last year or 2, last couple of years. So the clinical content knowledge management guidelines for our organization, we actually created a policy statement and guidelines on how to transition youth, when to transition youth, what are the resources to help guide all clinicians at UW Health, and that was completed in the summer of 2016. So a lot of the work in this pilot project is really kind of springboarding from the work that we had done last year. You can go to the next slide. Yep. So just quickly, our activities of our particular transition grant. So we are giving the GOT Transition Readiness Assessment questionnaires to all youth between 15 and 21 years of age at all well child checkups during March through September in 2 pediatric practices. So myself and Dr. Delgadillo, we are both seeing quite a lot of well checkups this summer. This is the time it's our physical season, so it's been good. We're starting to ramp up a little bit in terms of our numbers. We're basically providing the readiness of the assessment questionnaires, and then also providing some counseling and education regarding transition through our conversations during the well child checkup, through the questionnaire, and through handouts. And so it's been, we've used a lot of the resources through GOT Transition. We've done our own searches. We've gotten advice from our youth participants about what kinds of issues might be important during the transition process. So that's been really helpful. We are documenting in the progress note through a quick dot phrase that we have discussed transition with the youth, and that is what our project coordinator is helping us to look at in terms of the numbers of whether or not that was documented and whether or not that was done to help us to figure out. That's one of our outcome measures, is to see if we've actually done that transition counseling and education. And then we also have a post-survey questionnaire on the computer, really quick, just a handful of questions that we ask about whether or not the counseling was helpful. And then we're also doing a little transition educational event. So at the UW Health Specialty Clinic. So I work in the primary care clinics, but we realize that, if 1 in 5 children are youth with special health care needs, and those are the kids who might have more issues with transition, that in order to reach them, we probably need to go to, the specialty clinics where many of them are getting their specialty care. So in the lobby of the specialty clinic in about 2 weeks, we're going to have a little interactive booth going on where we're going to have materials and education about transition, materials that they can take home. We're going to try to make things fun and interactive by having like a little game and a booth. We have gift cards and raffles and just kind of some little bit of freebies for back to school, kind of stuff like pencils and notebooks. But we're really trying to help families learn what kinds of things they need to be thinking about as their kids transition. So we're hopefully we're kind of planning for that, and I think we're on track, but I will keep you posted on that. So just some of our data so far, we haven't completely looked at our June and July data, but in terms of the readiness assessments and counseling on transition, the right-hand column is the number of well checkups that we've had, and then you can see the percentage of kids who got the counseling and the readiness transition and both. And this one is just a graphic representation, almost like a run chart of, so basically a baseline, which is the month of February before the pilot started. We were not doing any formal readiness assessment or counseling on transition that could be, that was documented, could be identified by an outside source. So starting in March, we changed that. We implemented this in the 2 practices, and we've had some ups and downs, but hopefully we're going to kind of stay kind of on the upside, and hopefully that will make a difference. So some of the challenges of the pilot project actually been challenging, even just to do the pilot activities that we proposed in order to look at this and how this can function in a busy pediatric clinic, because we really, in general, don't have time to address all the healthcare issues that a patient has, even at a regular well child check sometimes. It just depends on what's going on. So even a couple of minutes extra sometimes is a little challenging. So that's been a little challenging. We've had a few glitches with our computer to get the Qualtrics survey up. So sometimes we did the transition counseling, but we don't have the Qualtrics post survey. So there's just been little glitches there and here and there. And then just finding ways to adapt the transition education to the needs of the patient. So for typical youth, I think providing that questionnaire might be enough, but for youth with special healthcare needs, we might need to create more specific checklists for their healthcare needs. And I know that some of the specialists are already doing that in their own clinics as they are starting to ramp up some transition programs. And I think connecting with those specialists and having the ongoing conversation of how do we ensure that the kids are ready to transition, that they understand what needs need to be met. I think those are the ongoing challenges that we have. But I think that it's been helpful throughout this process to get a sense of the resources and the tools that are out there. So having those on hand in primary care has been really helpful. Certainly the input of the youth on the grant, Sophie, has been really helpful in our approach to transition. Having her let us know that, transition is a really scary time and that she appreciates getting information about, mental health and sexual health and how to approach patients. I think it was really helpful. And I know families are really grateful to have this information. And for the most part, most youth thought it was probably or definitely helpful. And then this pilot project is just a bigger part of a bigger transition initiative in our organization, which has also been helpful in working on letters to the specialists for primary care providers and also checklists that we can check off transition education. I think working in the context of a bigger steering committee has been very helpful.
Great, thank you very much, Mala. All right, so that concludes all of our presentation slides from each of our 5 grantees that are on the call. We have about 10 minutes remaining, so I wanted to leave time for discussion. And I had kind of alluded to the idea that we would be talking about some of the challenges and some of the successes that each of the grantees has experienced. One of the general themes that I've just heard over my time working with the grantees, as well as just the general theme that tends to fall on those that are trying to implement transition, is how to engage with the adult provider world. The pediatric world has a different flow to it, a different way of doing things. And then when the youth themselves is starting to take control of their health care, as well as other things in life-changing events that are taking place, then they're moving to an adult system that operates very differently from the pediatric world. And there's also oftentimes just miscommunications or different communication styles for the pediatric world and the adult provider world. And what we tend to find is that grantees are typically in the pediatric world, know the transition is an important topic that needs to be discussed, or working in specialty clinics where there is that level of transition that needs to take place in order to ensure continuity as that individual is transitioning. I will open it up to our grantees who are on the call. Any challenges or solutions or ideas that you've had for really trying to engage with the adult providers?
I'm here, but I got nothing to add.
Well, the other topic that I thought we could kind of touch upon, because I know everyone's just trying to work towards this as well, is the family engagement aspect, and specifically with transition. Then we start talking about the youth involvement as well. So not just wondering what the families need, but also what the youth is wanting, which can sometimes complement or even sometimes go against maybe what a parent is expecting. So how have people been engaging youth or youth and families in their work?
Maya, this is Mala. So we were able to engage a youth in our project, and that's been really great. We've had a little bit more challenge trying to get a family involved, just in terms of being able to come to our meetings. They were, during the day, and just trying to find a way to make it all work. So I actually decided to talk to our Patient and Family Advisor Partnership Program at UW, and to try to identify a few families who might be willing to participate. And so that has actually been helpful if anyone has, that kind of program at their institution. That's just a way to maybe find some families who might be engaged to, participate in these kinds of grant activities. So I'm hopefully going to be able to talk to some families who have youth with special health care needs to kind of get their input on some of the work that we're doing in primary care, but also just in general in the transition process. What are their thoughts? What are their experiences? And hopefully that will inform our organization as a whole to move forward in a more patient-centered way.
So at this point, I think I would like to respect our 5-minute time frame, and there doesn't seem to be a whole lot of discussion at this moment. Probably pondering, thinking about how your events and work kind of align, or maybe are a little bit different from the other grantees on the call. But just to let you know that these the descriptions of each one of the projects, as well as this presentation, will be available afterwards. So sometimes it takes a little bit of mulling and thinking over, thinking, oh, that grantee is maybe doing something that we're interested in doing, or we actually had a solution that we could assist with. Again, we do encourage that type of cross-grantee communication, so always feel free to reach out to me or to the grantee specifically if you would like to offer support or would request some assistance from anyone who's presented information that you find interesting or helpful. We have been able to hear from all 5 of our grantees, and I appreciate them pulling together information. We typically do this learning community in the September-October timeframe, so there's a bit more time where the activities have either taken place or the events have already been done and people are able to report out on those. So I appreciate everyone doing this in a more expedited way. Again, we've now completed the requirements for this learning community, and we thank everyone for joining us today. Again, this information will be available on the website afterwards, and thank you for joining us. This concludes our presentation. Thank you all for joining. Goodbye.